Good afternoon, everyone. My name is Bob Lay, and my pronouns are he, him, his. I'm the program manager at San Diego Pride. Welcome to our San Diego Pride live stream, Not Our First Pandemic. As the COVID-19 virus continues to impact the globe, taking lives, crippling economies, and bringing entire countries to their knees, it's easy to feel like we as individuals are helpless against its onslaught, or too powerless to make a difference in the outcome. It's easy to lose faith when we read about hoarders, price gougers, and plague parties, while others are struggling to stay alive or suffering under extreme conditions of quarantine. However, we in the LGBT community know a thing or two about pandemics, and the COVID-19 is not our first pandemic, not our first community crisis. As LGBT people, we long ago learned to choose our own families. LGBT folks have traditionally had to rely on a more communal definition of family because until fairly recently, many LGBT people were rejected by their families and no LGBT person could legally marry or adopt children. The traditional roles to family were literally closed off to LGBT people on a personal and societal level. And no period during the last century of the LGBT life demonstrated that so devastatingly than the AIDS crisis of the 80s and 90s, which ravaged the gay community, killing off an entire generation of gay men, while society and even their very families stood by impassively, ignoring them utterly. It was in this environment that people from both inside and outside the LGBT community, some of the people you're going to meet today, came together to provide solace, comfort, necessities, and dignity to a generation of LGBT people affected by AIDS. Drag queens twirled, joked, and lip-synced to raise money for research or to assist people living with HIV and AIDS. Gay men and women organized politically and took to the streets to scream their rage and shame the community at large in organizations like ACT UP. Men and women of all backgrounds provided assistance, helped organize meds, doctor's appointments, drove the sick to where they needed to go, raised food and money to buy food for those who could not have food, made sure they had enough to eat, and when the time was ready, made arrangements for their burials because there was no one else to do it. It was a time of great fear and loss and despair, but it was also a time where the LGBT community and the LGBT people and their allies came together and did everything in their power to help provide and end the pandemic as quickly as possible. And so with that, I am excited to introduce to you today an amazing group of panelists that we have with us. And I'm going to ask them, Tyler, if they could introduce themselves. Maybe you can pull them all up and let them introduce themselves, their name, their pronoun, and the organizations they represented then or worked with or still work with. So, all right, Kim, would you go first?
Sure, thank you. My name is Kim McAlister, pronouns she, her, hers. In between 1983 or 82 and in the early 90s, I was a member of the Women's Caucus of the San Diego Democratic Club. and we organize the Blood Sisters of San Diego.
Thank you. Ruth, would you tell us about yourself next?
Hi, I'm Ruth Henricks, and my pronouns are she, her, and hers. And in 1991, I saw the need to help people who were dying from complications of AIDS. And therefore, I started Special Delivery San Diego, a home delivered meal service for people living with AIDS.
Thank you, Ruth. Susan, how are you over there?
Hi there. Good afternoon. My name is Susan Jester, and I'm the founder of San Diego AIDS Walk, originally called in 1986 San Diego Walks for Life. And my pronouns are she, her, and hers.
Thank you, Susan. You know I'd be in. John, would you go next?
In 1975 as the co-chair for the parade, and also in Susan's AIDS Walk, Walks for Life with the San Diego Veterans Association. And I'm a long-term survivor, having tested positive in 1988, and I worked in AIDS services at the center and also for Being Alive. And I'm currently involved with Pozibilities, which is a support group for people with HIV.
Thank you, John. And last but not least, Terry Cunningham.
Hi, my name is Terry Cunningham. My pronouns are he, him, and his. I am the retired chief of HIV, STD, and hepatitis for the county of San Diego. I started the Ciascio Memorial Clinic in 1982 as a gay male screening program, and it is still in operation through Family Health Centers over by Mercy Hospital. I am currently the president of the board of directors of the Liver Coalition of San Diego County.
Thank you, Terry. And thank you, all of you, for being here with us today. With over 8.9 million people testing positive for COVID in the United States and almost 230,000 persons dead, it seems pretty bleak. But we've been down a similar road before. You all represent different sectors of our community that survived the different pandemic. So I will be putting some questions to you. And the first one, people often say there's similarities that we can draw between the AIDS crisis and the COVID pandemic. And yet they are different. All of us on the panel today have lived through both the AIDS crisis and the COVID-19. Some say it's a sense of deja vu. It's all over again. Here we go again for those in the AIDS, in the trenches of AIDS during the 80s and 90s. Would you agree, Susan, or would you disagree? Do you think there's any similarities or differences that you've noticed?
I think there are some of each. The most outstanding one difference to me is that with COVID, there's a great deal of compassion and public support and empathy for folks who are ill and who have contracted the virus. That was not the case with people with AIDS. There was quite the opposite. And the similarities are the leadership of our country ignored both, and however used AIDS as some did as a tool of political negativity towards our community. So those are the two differences and things I see the same. I mean, we also lost 200,000 something folks in the first 3 years. And I well remember the quilts out on the mall in Washington of 200 something thousand people. So,
Thank you. Yeah. Ruth, you were nodding your head, Ruth, when Susan mentioned shame. You were feeding people from the start.
Yeah. Well, I think what Susan says is true, and that there is a great deal of compassion from the general public for COVID-19 sufferers, but I never saw that, or rarely saw that, in the general public for people who were suffering from AIDS. Also, another thing that I noticed that irritates me every time I see this now is that every night on the news they have a certain, like a roll call, a number. This is how many people have contracted COVID, today, yesterday, whatever. This is how many people have died. We never saw that emphasis on people who were dying or suffering from AIDS back then. So I think the general consensus of the general public is so different in that respect.
Thank you. Terry, being involved from the beginning as a medical doctor for the county.
No, no, I'm not a doctor.
I'm sorry. Okay. You were the head of the county. I'm sorry?
I was, I've always been an administrator, not a doctor.
Okay. All right. Thank you for clarifying that. But as an administrator with the county, was there pressure to put numbers up? Were there people want to, or did we do that, not do that on purpose? A tally.
The county always published the numbers. Unfortunately, money didn't come in from the federal government until 1990. So basically, we started out in 1982 with zero. Unlike with COVID, there was already some money there. There were already medical systems in place. We had to start everything from the ground up.
Mm-hmm.
So, we did have statistics, but not until later on in the epidemic.
Okay, John, Susan mentioned how both situations are similar in that governments have seemed to not gotten it right to start with. John, you were part of a group called ACT UP San Diego that was involved here, John? Is that
I was on the peripheral of ACT UP. I don't really think that ACT UP took off in San Diego. It was more New York, San Francisco thing. And we had our own little community that had to take care of itself down here. But to get back to what Terry was saying about the numbers, I think we really wanted to encourage numbers right at the beginning, and the only press that we really got was the gay press. People talk about opening up the Bay Area Reporter or something like that when there would be so many obituaries, they would fill up the middle pages of the paper. But most of the reporting was in the gay papers, and that's where we got the PR. And it was a different. You have to remember that we didn't have the internet. We didn't have the kind of connections that we have now. We didn't have the openness. And I think a lot of the numbers were repressed because people did not admit that their loved ones died of AIDS. They would say their loved ones died of cancer or heart attack or whatever, they hit by a car, but they wouldn't say AIDS. And for the longest time, that did not appear in obituaries. So that could have affected the numbers a lot.
What are some of the lessons, do you think, the LGBT community has learned in responding to the AIDS crisis that helped us respond to COVID? Are there things that we did then that we learned and we were able to do today to help our community respond? Kim, I'm going to throw this one out to you first. Maybe something. Tell us. I do want you to tell us a little bit about what the Blood Sisters were and what they did, and was there anything similar like that maybe today?
The Blood Sisters was organized to help accumulate for blood donors to accumulate credits, financial credits for blood that was needed by other people. The blood bank at that time, if you needed blood, you either paid for it or you could, if you had donated blood or somebody donated it for you, you could get credits and therefore would not have to pay for it. And with a common term between now and then is modes of transmission. And that's information that is driven by science, but it's connected to prejudice. And the blood banks across the country all said, if you're a gay man, you cannot donate, period, no matter what. It was just you were a gay man. And that was, regardless of your activity or anything. And so, and certainly AIDS patients at that time needed, they had some of the drugs that they were given, they needed massive amounts of blood. So they were under a tremendous financial problem then. Blood Sisters was organized by Barbara Vick, who was a member of the San Diego Democratic Club, which was San Diego's first gay and lesbian political organization for electoral politics. And we thought maybe 50 people max, women max would show up when we organized it in 1983, and 200 women showed up. And that just blew our minds. We had news people, we had news coverage about it, and the people who contributed, the women who contributed, were very proud to be able to do so. So half of them were lesbian separatists who didn't want to have a thing to do with gay men, but it was a lesbian event. And the symbolism of it far exceeded its actual benefits. It just melted the hearts of the gay men around us to think that perfect strangers would come and donate their blood for you or for us in the community. I think that all of the people, I would have to say nowadays, primarily women who sew masks, and I know men sew too, so we call them sewists as opposed to seamstresses now. But it is a truly groundswell movement of, if you have a sewing machine of any kind, since March, people have been sewing millions of masks and just giving them away. So on some levels, I think that that's the commonality of, if you've got something you can contribute, to do so. I also think, one last thing, I think it absolutely solidified women feeling and being invited into a unified community with gay men. Prior to that, there were tensions, and there are always tensions. But certainly, I think that was the key. United, we stand. Divided, we die.
Together, we rise. Terry, at the county level, how was the county? What do you see as the county then, the county now? And I don't want you to get in trouble if you got to criticize. But I mean, what did you? You were there when the county was deciding how to respond to the AIDS crisis of the 1980s and 90s. And now, do you see that they learned lessons from what you did, so that when they responded to COVID, it was a little bit easier?
Well, I think that the AIDS epidemic really created a lot of systems for getting information out and educating the population about what the truth is about the disease. Now, whether people want to listen to that truth or not is, of course, up to them. And masks are the condoms of the COVID epidemic, and it's a lot easier to get somebody to wear a mask than it is to get them to use a condom. And at the early days, we had to educate people about sex, not only about the disease, but there was such a dearth of information about just sexual behavior that we have a lot of educating to do, and there weren't very many people doing the educating. In San Diego, there were 2.5 of us doing the education to 300,000 people. So I think that the systems that were put into place really helped with the COVID pandemic that's going on now.
Thank you. You talked a little bit also about science. I mean, when did science, and I don't know, I throw this out to the group panel here, and who wants to jump in first, but when did science become something we didn't trust versus, listening to the experts, the scientists, the medical experts? Were they seen as trustworthy during the AIDS crisis? I mean, I know Fauci was around then, and some people thought he was the worst thing or the best thing. So I'm curious.
It changed. It definitely changed. I mean, people nobody knew in the very beginning. Nobody knew how this disease was transmitted, what you could do to keep yourself safe. And we realized early on that universal precautions were the basis, just like, the social distancing and wearing a mask today. It was, back then, it was using a condom and limiting your number of partners. So there are similarities, but there are significant differences too, because HIV is not transmitted through the air, and COVID is.
Right. John, Susan, what do you think? Is science something that we should? I mean, it seems today people want to fight science and disregard science. Was that the way it was? Did you think back in the AIDS pandemic time?
Well, we really tried out. There were a lot of remedies that people were trying at the time, trying to find out what was going to work for them particularly, and going to Mexico and things like that. But I recall a story that I was told that when I was a peer counselor about a guy whose partner was in the VA, and the VA employees at that time would leave the meals and the clean sheets in the doorway. They would not go into the room because they were so afraid of that AIDS was airborne. And when you think, okay, this is the person, these are the people that I'm trusting with my health care, and they won't even come near me. So there was a lot of misunderstanding, a lot of mistrust between us and the medical establishment. And
Right.
Some people wanted to quarantine all gay men because they assumed that HIV was a gay disease.
Right.
So let's just put them on an island, which was literally talked about. Put them on an island, and it was nothing like it is now, where we go, okay, I can still go to the grocery store, or I can still have this person over for barbecue.
And our healthcare, John, our nurses now are the frontline, are the heroes. Like you mentioned, that the healthcare some medical personnel wouldn't even go into rooms.
Right.
I remember people. We know the stories of people not being buried, and the imperial court coming to raising money to them.
Right.
So yeah, it's an interesting difference. I mean, is some of that different now today because of what we learned? Are LGBT people able to better handle? Because of the AIDS crisis, are we better able to handle COVID-19? Ruth, I mean, you have people who are living with HIV and AIDS and other, serious life-threatening illnesses, and their hunger is a need no matter when. What are you seeing, Ruth? I mean, are you seeing your HIV, LGBT clients? Are they being more resilient this time around? Are they being able to handle this pandemic a little better?
I think some of them are. We have people who still come to the pantry who share with me, and I think that they see the similarities with both pandemics. But I know that the ones that I have spoken with who come to the pantry once a week, they're thankful for the food, and they're thankful for the opportunity to be able to carry on at a time when there's not much income or where there's no job availability. But I'm kind of agreeing with everybody to a certain extent. Going back to the science, I remember, and I guess maybe, I don't know if I have a selective memory about this, but I remember so many of the people from the HIV community at the time when they were looking into trying to find some type of a drug that would help, maybe not cure it, but yes, maybe cure it. A lot of the people were getting so sick from the drugs, and they were saying that they thought that I don't know if I'm saying this correctly, or expressing what I'm feeling in my heart, but these people were saying that they thought that they were selectively being killed off by this medicine because it's a way to eliminate the gay community. And I don't know if you ever heard that, but I heard it then. Of course, I'm not hearing it now with COVID, but I think that it's touching a different segment. I mean, COVID is touching the world, and not that HIV didn't, but it just seemed like a lot of the HIV community were feeling like they were being selected so that their community would eventually phase out because of the disease. In other words, excuse me for my candor, but it would be a way to get rid of them. And, and I don't know if anybody else sensed that or not.
Yeah. Ruth, real quick, I just want to throw a plug out there. You are a CNN hero as the founder and executive director of Special Delivery, all volunteer organization that feeds people since 1991.
Yes, 91.
People with HIV and AIDS, and now only in the last few years with more serious illnesses such as heart cancer, diabetes. Thank you for what you've done for our community, Ruth. Thank you for what you continue to do. I see the trays and bags back behind you with lunches ready to go out today. And you said you have a food pantry. So thank you for that. John, or somebody mentioned the quarantine. I mean, it seems as though this is the first time in my life I remember reading about it, because I'm probably close to being the youngest person on the panel today. And I remember reading about, quarantines and threats of quarantines, and some crazy senator named Jesse Helms. But I guess I never felt that was real, where with COVID-19, there's a real sense of quarantine where we're locked down. Did any, Susan, Terry, Kim, John, did you feel that sense? That share with me, because John, you mentioned something about a quarantine.
Well, I think
Susan,
I don't think it was so much a sense of quarantine. First of all, again, how the disease was transmitted was totally an unknown factor. And at the very beginning, the CDC and other government agencies kind of didn't really pay much attention to it. I also think once they labeled it a gay cancer, that it was sort of, okay, a bunch of gay people are dying and it's not that really important, until it started to, numbers started to multiply. And the other issue around AIDS is it's a sexually transmitted, basically, disease. So there came a lot of judgment, and it wasn't the same as you get COVID by being in the same room with somebody. But they didn't really know and didn't really pay a lot of attention to it until numbers started to raise, and finally CDC came out with some facts about, once they figured out how it was transmitted. I mean, I understand it's transmitted in other ways besides through sex, but it's not in the air like a lot of people thought at the beginning. I remember visiting someone very early on, 1985, I think it was, in the hospital, and they had me put on like a hazmat suit to go and visit this person who was dying. And I stood outside that room, because none of us knew at that point, for several minutes, talking to myself and my conscience about, am I going to let this guy die alone, or am I going to overcome my fear and trust that God will take care of me regardless? But it was quite a scary thing. I remember the area of the hospital was kind of cordoned off, and you passed a certain point going down that hallway, and there were yellow stickers, and it was quite a traumatic thing to visit someone with HIV.
Right.
I don't know if I'm making sense, but
No, you're good. And
there was so much stigma attached to HIV that is not attached, and unknown factors as well to HIV that is not the case with COVID. But I think that taught the folks at the CDC a lot about, addressing other pandemics. And only until recently, I think, has the trust in the CDC and the government research and doctors been vilified and turned into something that it's not.
yeah, thank you, Susan. Kim, and then Terry, I want to come to you in a minute. But Kim, you were nodding about stigma and fear.
Yes.
I mean, I can't imagine that, because even now with COVID, I mean, I throw my mask on and I go out. I'm trying not to let that determine how I live, but fear and stigma were a big part of life. Can you share a little bit about that, Kim?
Well, my other half, Bridget Wilson, was an RN or LVN at that time, working with Dr. Brad Truax, and he was a medical doctor who developed an HIV by default, an HIV practice. And I worried. I was like, well, Bridget pokes herself with a needle, or if it would, it took years to really find out how AIDS was transmitted. I mean, it used to be sharing of bodily fluids. Well, what's that, right? I mean, it was broad in the beginning. And they did hone it down a bit, but still. So I remember being scared before I ever met my first friend with AIDS. And you do a gut check. I only had immense empathy for the men in our community, because that's your life. And those are your people. Those are your peeps. That's your family. It's everybody. I mean, COVID now is everybody. I mean, 3/4 of this panel are in the high risk factor for COVID. So how are we responding now to fear? Because really, for the first time in a very long time, I look at this now and I go, oh, shit. Shoot, I could have this. I could get this. So what am I doing? Bridget and I we're not even in San Diego right now. We're in our place in Palm Springs, and we don't see anybody. I haven't been to a grocery store since March. So are we paranoid? Yeah. Do we think we come by it honestly? You betcha. So
that's really interesting, paranoid. Terry, I can only imagine the beginnings of working in the county when this was new, and you're reading about this grid and other disease, this disease, and it's spreading from New York to Los Angeles. And then I can just imagine trying to figure out day by day, the information must have just had people questioning and pulling their hair out. What was it like during that time, Terry? And where did you go for information?
Well, it was a pretty horrifying time. We tried to get information anywhere we could, and it was amazing the systems that were developed. I kept in contact with counterparts in LA and New York, trying to get the latest information. And as far as the quarantining was concerned, Lyndon LaRouche mounted an initiative, Proposition 64, to quarantine anyone who was HIV positive. And we mounted a huge response here in San Diego. I was the president of San Diego Says No on Proposition 64. And we defeated that proposition, which would have absolutely quarantined people. And we realized that was not the way to go. And we had to convince people that was not necessary, and that how evil that really was. In fact, I debated LaRouche's second in command, Grauerholtz, on the radio, and it was, he was just crazy. The things that came up were just amazing, and I basically said, "You're lying," and he went off the wires. But we were able to defeat that. But we raised a lot of money and had to put a lot of effort into defeating that proposition. It was not an easy task.
I'm thinking, Terry, also about our medical leaders today. standing behind political leaders just shaking their head with the things that are being said that are just not true or so dangerous. Was part of your job dispelling the bunk and cutting through the BS to make sure people got the real information?
Yes, it was, but being the county, I could only say certain things. I could not do what they did in New York and use expletives that we couldn't use here in San Diego, which was unfortunate. We still don't have a clean syringe exchange policy here in San Diego. We have a policy against it. We tried to get that reversed before the COVID epidemic hit. And unfortunately, the Board of Supervisors would not reverse it after 30 some years of research and education. We're the only large metropolitan area that doesn't have a sanctioned needle exchange. We have a small needle exchange program run through the city of San Diego with family health centers. And it's, using dirty needles is absolutely a way of transmitting the disease, transmitting HIV.
Yeah, thank you, Terry. Back in the 80s, Terry, you mentioned condoms. Today it's masks. Back then it was fewer partners. Today it's 6 foot. We had to make some changes both then in our lives and today. I guess I'm wondering what was some of the biggest changes, and I'm going to ask you all I'm going to go around to each of you. What were some of the biggest changes in your life, whether it was the direction your life took or what that the AIDS crisis brought about? And then we'll come back to a follow-on question for each of you. So, John, we're going to start with you. How did HIV in the AIDS crisis change your life, John? And you're on mute. You're on mute. Unmute yourself. There you go.
There we go. Wow. It changed my life totally. I'm a totally different person than I was. I didn't realize when in San Diego there was, as far as I could find, there was no education back in '88 as far as this is what you do if you test positive. My doctor said you got 2 years to live. Get out of here. And so I went and partied for those 2 years. And then when I didn't die, I decided I had to do something different. So, but also at that time, there were a lot of people that I was close to who were dying, who were so sick that they couldn't carry on with their careers. And we just pulled in. And I think that you talk about whether you want to trust the medical profession. We trusted our peers. We went to people that we knew. We went to other guys who were taking ACT or Truvada or whatever it was at the time and said, okay, what's it doing for you? What are the side effects? What can I do? Where can I get panties? Where can I get rubber sheets? All this stuff. We went to our peers. And so we really pulled together. And so, but it changed my life totally. I'm a different person.
I'm glad to know you, John. It's been my pleasure. Ruth, what about, I can only imagine, Ruth, you were a restaurateur, and now look at you.
Yeah. I started buying the Huddle in 1986. So my concentration was paying off the Huddle and learning more about being a restaurateur. In 1990, I ended up meeting somebody who came to the restaurant who I could tell was visibly suffering from AIDS and going downhill. And after quite a period of time, lost contact with him. And so because of that, I thought, if he has no one to cook for him, there must be others also who have no one to cook for them. And I have this God-given talent to be able to cook. So put those together with people who are hungry and starving. I only meant to have this I only meant to be able to feed people in my community, Mission Hills, Hillcrest, North Park, for maybe at the most 2 years. And but it has totally changed my life, so that obviously it's been more than 2 years. It's been over 29 years now since officially we've been feeding, and we're still feeding people living with AIDS. In fact, for our home delivery, I would say about 50 to 60% of our clients still are suffering in some capacity with AIDS to a lesser or greater degree. And so, yes, it's changed my life. I went from never volunteering in my entire life until I came to San Diego to now volunteering to do this. And it's one of the most gratifying things that I've ever experienced. And one of the things that I did want to mention about the AIDS community is what I found during those early years, maybe first 5, maybe up to 10 years, there was such love demonstrated in the AIDS community. All of us who were working together to battle this, to try and do something in our little corner of the world to make our talent make a difference to these wonderful people. And so we all had this in common. And over the time, I met some wonderful people, and some I still am in contact with. And I don't sense that in the, if you want to say, the COVID community, because we are kept separate. We're kept at least 6 feet apart. There's no opportunity to hug, to embrace, to kiss. And so I've really enjoyed being a part of this whole process. And yes, it's changed my life. I was going in one direction and I turned out and I headed in a different direction.
Yes. Well, thank you, Ruth. And I promise you when we're allowed that you will be second, because I promised Susan she'd be first, to get a big hug and a kiss. Kim,
I can hardly wait.
Yeah, right. Kim, what about you? How has the AIDS crisis affected you and Bridget? How has it changed your lives?
Immensely. I think that learning about self-care and being self-aware, I get emotional. I think that complicated bereavement is something that I think our healthcare providers now are learning because they're the ones watching people die over and over and over. We're not watching the people die right now because we can't go to the hospital. We can't go to the nursing homes. But back then we did. I mean, it was invisible war. I'd go to work and I'd think, I just went to 3 funerals over the weekend. I just know 200 people who died, and nobody else knew that. COVID at least is across the board here. So that's the benefit of it. But I also think that having community is very important. And the hardest thing about this isolation is not being able to hug and kiss your peeps. Our families are us, and we're caring for each other by being separate. That's damned hard. Sorry, that's what I think.
That's okay. That's okay, Kim. Thank you. Terry, I can only imagine how this has changed your life. I mean, curious, Terry, you say you were an administrator for the county.
Yeah.
But you obviously didn't plan to be an HIV administrator because that wasn't around probably when you were going to school, right?
No, not at all. Yeah, it changed my life significantly. I started the Ciasio Clinic back in 1982, and we were getting out information, and I became known as somebody who had the latest information about AIDS, and people would ask me questions, and I would tell them I'm not a doctor or a medical person, but here's what I know. But I had to stop going out. I enjoyed going out, but I would go out, and invariably somebody would come up to me and say, "Oh, could you come over here? Could you come in the bathroom and look at my ankle? I've got this spot, and I want to know if it's it or not." And it was like I just couldn't do it anymore. And plus, I was working a full-time job and doing the Ciasio Clinic on the side and doing HIV education on the side. My life was just filled with AIDS work. So I really didn't have time for a social life. But all in all, it's just been an incredible honor to be able to help my community. And I'm just grateful that I've had that opportunity.
Well, thank you, Terry. Thank you. Susan, you founded this little organization that evolved and morphed into AIDS Walk. But I didn't know this until I met you, that the first rendition of that was called Walk for Life. Why was it not called AIDS Walk, Susan? And I would like you to answer that, and then tell us how AIDS epidemic changed your life.
Well, as someone earlier mentioned about the word AIDS and the stigma around it, at the time, we couldn't get people to even write a check with the word AIDS on the payment line. So in order to, because my passion about it was I wanted to be able to help change public opinion about HIV, and I felt like the walk was something that would create a different image of the disease. So we called it San Diego Walks for Life, and that was the reason, because I couldn't put AIDS fundraiser on posters. Nobody would put them up in their store or on any of the literature at all. So that was the reason for calling it San Diego Walks for Life. And yes, the AIDS epidemic changed my life dramatically. I've always been sort of an activist and warrior on various things of equality, but like Kim said, when you see personally, as I did, cross out 265 names, I stopped at that number out of my address book over the period of about 3 years, and personally was with so many of those people, getting in their bed with them as they were taking their last breath. I was so determined that we needed to change public opinion and public view of what HIV is about. And I felt that the AIDS Walk was absolutely necessary to do that. And I think it played a great role in it, because we got a lot of straight people and celebrities to participate that first year. And it kind of changed the image of, plus the people who walked were nurses and people, So it made it, because I'm trying to remember, I think I was about 40 years old when in that year, 86, or started it in 85. It gave me a whole different perspective on what the government can and cannot and will not do, what public opinion can and will change about folks, people, and about the lack of concern or the lack of compassion for our community in a time outside the realm of our own community. It didn't matter to folks, the general public. And of course, you had a United States president at that time who didn't even mention the word AIDS until his last time in office, after 200,000 people died in that situation. So it changed me in the way that I made it my life's work to make sure that the folks who, I'm going to joke up to, who can't speak for themselves, I was going to make sure I was going to help them be their voice in whatever the situation. And at that point in time, it was people, it was my friends with HIV, because I don't think people still understand today. There was no medical help. There was no Medicare. There was no Medicaid. There was no Social Security. There was no organizations to provide food. There was no burial expenses. There were parents, and there still are families who have not picked up the remains of their deceased son or daughter. So there was no help outside. With COVID, you know that there's certain drugs that, you know, the death rate is not anywhere near what it was with HIV. And back in the day, in the 80s, if someone was diagnosed with HIV, they had about 3 months to live. And during that 3 months, there was no help. They'd come home. If their roommates found out they were HIV positive, they'd find all their clothes and stuff out on the street corner. And all the guys and gals that were in service work, in restaurants and that type of work, lost their job immediately with no help whatsoever. So I see a lot of help with COVID because times have changed and medically we can address these things. There's no vaccine, and no vaccine right at the moment that I'm aware of being planned for HIV. So a different time, a different place, but it definitely changed my life, and I took a different course the rest of my almost 77 years now.
Thank you, Susan. Thank you. These programs that we do are an opportunity to cross generations, and this is definitely one of those programs I think that is going to be able to cross the generations, because, as you all said, it was a time then and it's a time now. And for younger folks today, I wonder if I don't know. We've come a long way with our HIV and AIDS treatment. We've come a long way for prevention, education, but it still seems as though there's people getting HIV still. And I'm wondering, we'll start with you, Terry, if you don't mind. What would you say to our younger viewers? What would you say to the younger generation that's listening today? What would you like to share?
Well,
Go ahead.
the main thing is that we still have one case every day reported every day. So AIDS has not gone away. And it is, with COVID, you've got two pandemics going on at the same time. And if you have HIV and you're not in treatment, it's a pre-existing condition, and it's going to determine whether or not you're going to be able to survive. If you're not taking the proper medications for your HIV, COVID comes in, your chances of survival are even less. People have to realize that, these are not independent diseases. These feed off of each other, and people need to be aware of their health care, what they do. Even your diet is going to be very important, and losing that extra 10 pounds is going to probably save your life, especially from COVID. Now, that wasn't the way it was with HIV. We tried to fatten people up. But I think that people just have to, younger people have to realize that this is not a joke, that this is very serious, and wearing a mask is going to save your life. The same as using a condom is going to save your life. And we have to keep educating people. And I don't see that education happening at the level that it was happening back in the 90s, in the 2000. So so much has to be done, and people need to take responsibility for themselves.
Thank you, Terry. Thank you. Kim, what about you? You've said you've kind of been isolating over there in Palm Springs.
Yeah.
Is there a message you'd like to share? Is there something you'd like for young people to take away from this? Or anybody?
Have some patience with science, in that sense of, we're still learning an awful lot about COVID. It is a medical issue. A virus doesn't know morals. It doesn't know political party. It doesn't know sexual orientation. It doesn't know anything except it's the virus's job is to replicate and find hosts and replicate some more. And so I think that if there's generational issues, all young people think they're going to live forever. And so I think that even though COVID is not only killing off older people, because most of us have coexisting, issues, but young people have less of that. But a lot of young people are dying of COVID too. So, or are transmitting it. And to me, it's kind of like wear a condom, wear a mask. I mean, it's the most generous thing you can do for your loved ones out there is wash your hands. I mean, and if we're saying it we're green, we're purple, just like we did back then about safe sex. It's kind of like, hey, these are simple things you can do. Right. You don't have to be a rocket scientist, but quit being oh God, I sound old.
All right.
I want to say quit being selfish. But really, it is an act of love and responsibility to do what you can do.
Susan, Ruth, and John, we've got about less than 5 minutes left. Quickly, Ruth, we'll start with you. What would you like to say, Ruth, in a minute to folks? What would you like to say?
Well, I'm not sure about what kind of education is going on right now with the younger people and the younger men in particular. I'll tell you what breaks my heart is when we put somebody on food service that's maybe 24 years old and already in full-blown AIDS. And I want to say to that person, what were you thinking? What were you thinking? And so my concern is still more with the HIV/AIDS community. I know that COVID is a very serious disease, but my concern is with the HIV community, and let's get some more education out and believe in the facts that are being presented, because yes, they do think they can live forever, and they also think, oh well, if I get HIV, there are pills now that I can take, and I've talked to young men who are taking 25, 35 pills a day for different things, because it isn't just HIV then it becomes other issues, side effects, depression and so forth. So I wish there would be more communication and more education, and if there is, then young people pay attention.
Thank you, Ruth. John, what about you? John, you're very active in our community. You're very turn your mic on, John. You're very active in the community. What do you want to tell?
I would tag on to what Ruth just said was, 30 years of taking meds, taking pills, has a terrible effect on your body. So even if you're a young person and you're starting out, the medications that you're taking for COVID and for HIV, it can damage your liver, can damage your kidneys, can give you neuropathy, can give you diabetes. So there's a lot of things. There's a lot of reasons not to get it, and wear a condom, and that will also protect you from STDs too. And tying into what Kim said, it's so sad that we can't have groups, we can't have community right now, and sit down with people and say, these are the things that we did, and these are the things that we'd love to see you do. So,
thank you, John. Susan, I'm going to let you have the last word. Be the grande dame of our group here today, and share with us. You got about a minute, then I want to wrap up. But what do you want to share, Susan?
Well, I think my parting thoughts are: wear a condom, wear a mask. There's no vaccine for HIV, and the consequences, if you think a little blue pill is going to take away all those concerns about HIV, it's tragic to me for young people And it took our generation to see hundreds of our friends die before we got the message. We need to change some of our behaviors, and then you can live. So wear a mask, wear a condom.
Thank you, Susan. Thank you, everyone.
Bob, could I just say one thing?
Yes, Terry.
I just want people to know that there are still 2,000 individuals who are HIV positive in San Diego that do not know their status.
Right.
So getting tested, which is free and available all over the county, in county facilities, in community clinics, is the best way to go. And we have between 13 and 14,000 people who have HIV and are living in San Diego at this time. So it's still a pandemic, it's still here, and we need to take precautions and definitely get tested. That's the first thing to do, because if you find out you're positive, you can get treatment and stay undetectable and unable to transmit the disease.
Absolutely. And you can get your tests done at the San Diego LGBT Community Center in Hillcrest and at the San Diego County. There are multiple. You can reach out to us here at San Diego Pride, and we will provide you with resources where you can get your testing. We're just about out of time, and I don't want to lose my technical people are saying, give me the wrap up. But Kim, Susan, Ruth, Terry, John, it's been my honor to spend some time with you today to get to know some of you more. And thank you for being here with us. I want to thank Mel, Tyler, and Alex, behind the scenes people who made today possible. I want to remind you all, and John, wave your hand. I want to remind you all that tomorrow at 2:00, Art of Pride, which John Keasler is part of. Art of Pride is going to do Dios de Muertos. John, help me. John, help me. Dios de Muertos. And we have a nice little Art of Pride live stream for that. And please, if you can, support HIV/AIDS organizations and San Diego Pride, special delivery, people that are doing good work in the community. Thank you all for joining us. Thank you, San Diego Pride. Thank you all. Bye-bye.
Thank you.
Kim, Terry,
Thank you.
Susan, Ruth.